You know that feeling, right? That incredibly smooth, fresh from the dentist feeling when you can't stop running your tongue over your teeth. But what's actually happening in that chair? Well, today, we're going to pull back the curtain on the professional dental cleaning and find out why this simple visit is one of the most powerful things you can do for your health.
So, you're on top of it. You brush twice a day, you floss, most of the time. You're doing your part, right? But here's the real question. Is that daily routine truly enough to protect you in the long run? Let's find out. Because, yeah, there are some stubborn little villains hiding out in your mouth that your toothbrush, no matter how fancy it is, just can't handle all on its own. And that is exactly where we need to go beyond the daily brush. We're about to find out why professional cleaning isn't just about making your teeth look shiny, it's your oral health's secret weapon. Okay, think of it like this. Brushing your teeth at home? That's like doing the daily tidy up in your kitchen. You wipe the counters, you sweep the crumbs. It's essential maintenance. But a professional cleaning? That's the deep clean. That's when you pull out the fridge, you get behind the stove. They're getting into all the nooks and crannies, especially below the gum line, where your brush just can't go. And the main bad guy they're going after is this stuff called tartar. You know plaque, right? That sticky, fuzzy film on your teeth? Well, if that's left alone, it starts to soak up minerals from your saliva and literally hardens into something like concrete. At that point, your toothbrush is completely powerless against it. You absolutely need a pro with specialized tools to safely break it away.
So we know why we've got to get rid of this tartar stuff, but what is a professional cleaning really? Let's take a look at what's actually happening behind the polish.
You might hear some fancy terms for it, like scaling or even tartarectomy. Yeah, I know, it sounds pretty intense, but all it really means is a super careful process of removing both the soft plaque and that hardened tartar from every single surface of your teeth, all the way down to the roots just under your gums.
And let's be super clear on this. This is not a do-it-yourself project. It can only be done safely by a licensed dentist or dental hygienist. They have the training, they have the right tools. Seriously, don't even think about buying those scraper tools you see online. You can do some major, permanent damage to your teeth and gums. Just don't do it.
Now here's where it gets interesting, because not all cleanings are the same. In fact, there are 3 main methods your hygienist might use, and knowing the difference can make your next visit a whole lot clearer.
First, you've got the traditional, manual cleaning. This uses those precise hand tools for that classic scraping feel, which is fantastic for tackling really heavy buildup. But the most common method today is ultrasonic. This uses a little tool that vibrates at a super high frequency to gently break up tartar, while a constant spray of water washes it all away. And finally, there's airflow. Think of it like a mini power washer for your teeth. It's a gentle jet of air, water, and a fine powder that's amazing for polishing away stains, and kids usually love it.
All right, let's get down to the nitty-gritty. I know you've got questions, so let's do a little rapid-fire round and answer the practical things you're probably wondering about.
First up, the big one, money. If you're paying out of pocket without any insurance, you can expect a standard cleaning to cost somewhere between $50 and $200.
But, and this is a huge but, here's the amazing part. Most dental insurance plans see this as absolutely essential preventative care, so they will usually cover 1 or even 2 cleanings a year at 100%. That's right, completely free. It's a total game changer.
So what's the magic number? How often should you be penciling this into your calendar?
Well, the guideline from the American Dental Association is pretty clear. For most of us, that's twice a year, every 6 months. Of course, your dentist might suggest something different based on your specific needs, but that's the general rule of thumb.
Okay, next question. Is this going to eat up my whole afternoon? What's the time commitment we're talking about here?
And the answer is no. You'll be in and out pretty quick. A routine, standard cleaning is surprisingly fast, usually wrapping up in about 30 to 45 minutes.
Now for the big one. The question that makes a lot of people anxious just thinking about it, does it hurt?
And I've got great news. For the vast majority of people, a professional cleaning is completely painless. If you do have really sensitive teeth or gums, don't worry, just let your hygienist know. They can use a topical numbing gel to make sure you're totally comfortable the whole time.
And what about after the appointment? Should you be worried if you see a little bit of pink when you spit?
Actually, a little bit of bleeding is totally normal, especially if your gums were inflamed to begin with. It's nothing to panic about, and it should clear up in a day or so. Think of it as a sign that got in there and did a really thorough job.
So when you put all of this together, the technique, how often you should go, how easy it is to get it covered, you start to see the bigger picture. This isn't just another appointment, it's a lifelong investment in your health.
and the payoff is massive. You're not just getting a brighter smile and fresher breath, you are actively preventing painful cavities and serious gum disease. And that, in turn, saves you from way more complex and expensive procedures down the road. It's the very definition of preventive care.
It really is a small investment that pays off in a huge way for your health and for your confidence. So at the end of the day, the question isn't whether your toothbrush is enough. We know it's not. The real question is, what are you doing to give it the professional backup it needs?